Well, the Alzheimer's OC Club is going to be meeting tomorrow, and that's going to be in Clubhouse 3 in room number 2, and that's going to be at 10 o'clock tomorrow, and that's going to be Friday, August 12th. And join us now is Dan Daly. He's with the Alzheimer's Orange County. Thanks for joining us on the program today.
Nice to be here again, Paul.
Yeah, it's great to see you. Now, the Alzheimer's OC, I believe you've changed your name. It used to be, Alzheimer's Association a couple months or so ago?
Last December,
Okay.
A decision was made by our board of directors to branch off from the national organization, which was Alzheimer's Association. And the reasons were numerous. Probably the number one reason was the fact that for every dollar generated and raised, 40 cents was going back to the national office. So they felt that this way, being an independent chapter, 100% of every dollar raised is going to stay right here in Orange County for research and also the benefit of families.
Absolutely. And nearly, 85,000 people in Orange County suffer from some form of dementia or Alzheimer's?
You're exactly right. 84,000 and climbing.
Wow.
It's the fourth leading cause of death in Orange County.
And there's no known cure at this time for this?
Not at this time. There are a number of medicines under development, but there is no known cure. However, there are a lot of things that an individual and families can do to cope with it during the very difficult, challenging time.
And that's why it's nice to have resources like Alzheimer's OC, because even on your website, you have all these things available to people to at least get some help. And like you said, the person that's suffering from dementia, they're not going to go to your site and diagnose themselves. It's usually going to be a family member or a friend.
Exactly. I'll give you an example. When a diagnosis is given by a physician, the first question asked, and it's usually a family member who's with the patient, is, what do we do now? Well, the physician, he or she, they're seeing patients every 12 to 15 minutes. They don't have time to go into the details of the services we provide. So what we do is we try to increase the awareness with the physicians and the medical providers to make them and their staff and their patients aware of all the services we provide. And all of the services we do provide are provided at no charge.
Wow.
Yeah, so there is no link with any insurance company. It's strictly with Alzheimer's Orange County and the community.
Right, and that's why I think it was so important that you all made that decision to keep that money locally, because you are not charging. You do accept donations, though, and I'm sure
95% of our revenue is generated by public donations.
Wow. Let's talk about your early stage services. What could someone experience if they were to, contact you and start this process?
I'll give you an example. Quite often, in Orange County especially, 60% of the caregivers are family members. None of them have really been trained to be caregivers. So when they start off, it's very mundane work that they're doing. So they might be making breakfast, they're changing clothes during the course of a week. All of a sudden, within 6 months to a year, behavioral changes kick in, and all of a sudden this loved one who's very passive, very congenial, becomes very hostile and aggressive. And they will turn on a loved one who's a caregiver and maybe swear at them, get aggressive, and that caregiver then says, I don't know if I can do this anymore. So all of a sudden the family has a compounded problem.
Right.
So one of the programs we provide is called a Savvy Caregiver Program, and it's a training program. And it's 6 individual 2-hour sessions where that family member learns to become a proficient caregiver. And this is done, again, at no charge. So that's one of the many programs we provide.
Wow, that's an incredible program, because like you said, a lot of time, the caregiver will sometimes pass away at times before the other person they were serving, because they're so stressed out and dealing with this situation. And like you said, no one's really been trained in this, especially when they take it on themselves.
Yeah, it appears at the outset to be something that is manageable, but as it moves on, it becomes very challenging.
Yeah, I've heard of situations similar to that where, the grandkids, especially if they're young ones, especially when grandpa is no longer the fun, happy guy and doesn't really remember who they are, or kind of like, scolds them because he thinks they're strangers in his home. And then the grandchildren don't know how to relate to that as well, or even how to react to it.
Or they challenge them by accusing them of stealing something.
Okay.
That's always a fallback position.
Amazing.
It's unfortunate, but this is what happens.
Right. Well, let's talk about this event you're going to have tomorrow. That's going to be at 10 o'clock at Clubhouse 3 in dining room number 2. And this is Dr. Gustavo Alva. He's a well-known psychiatrist. I believe him and his brother are from Mexico City and kind of established themselves here, and they're pretty well known.
Yeah, Dr. Gus Alva, he founded ATP Clinical Research in 2005, and he specializes in neurology and psychiatry. So the company itself, they conduct a number of central nervous system related disorders such as, and trials such as Alzheimer's, depression, and schizophrenia.
Wow.
So they're very well known, and he's a remarkable individual.
Right. So if you attend this meeting tomorrow especially, you'll learn about the latest research. And even though there's no known cure at this time, there's obviously many things we can do. And hopefully, at some point, there is a cure for this, terrible disease. It affects, I think, 5 million people in the United States.
5.3 million in the U.S., and without a cure, by the year 2050, it's going to become 13.2 million people.
Right.
Now, one of the things he will discuss also is that he'll talk about the clinical trials ongoing, but he'll also talk about as we age and what the effect dementia has on the memory. To give you an example, there's a component of the brain that's called the hippocampus. It's like the warehouse of memory. And over a period of time, it deteriorates. The other challenge, we have is the fact that as we age, blood flow to the brain decreases.
Right.
So that has an impact on memory loss as well.
Yeah, it's basically your brain is suffering atrophy because the neurons are no longer, talking to one another, I guess,
Correct.
And they basically just disappear and kind of just go to sleep, and then the cells kind of just shrink up and
that happens as well.
Causes a lot of issues.
Plus, you have external factors such as depression, drug interaction, thyroid disease. All that can have an impact negatively on memory.
Yeah, because when you hear that someone has passed away from Alzheimer's, you kind of think, well, how does someone pass away from memory loss? But then, like you just said, there's all kinds of other physical aspects that go along with it.
There are a number of complications that can set in. 13 years ago, I was a conservator for a good friend of mine, and he had passed away from complications from Alzheimer's. He actually developed a systemic infection, and that affected his heart and lungs. And that's what he passed away from. It wasn't Alzheimer's per se, but it was the complications caused by it.
Yeah. Well, we just had a segment that we produced, and we're actually working on it right now with Age Well. And Lisa Gibbons has been their nutritionist over there, and she had said that actually there's always differences, but she's saying now even avocados may help people with dementia. So there's nutritional aspects that could possibly help you in this process.
Absolutely. There are a number of different issues being addressed right now on the nutritional side, and collectively they can all help as far as trying to curtail the progress of it.
Right. And even crossword puzzles and words with friends and some of these games, even though they're on your phone, the brain is working.
The brain is similar to muscle activity.
Right.
You either use it or lose it.
Right.
And there's no question that if you stimulate the brain, whether it be crossword puzzles, reading, the number one on the hit parade is socialization.
Right.
And that's why this community especially, very, very active community, people are very active, and they're all self-starters.
That's true, yeah, and that's one of the great things about living in this community. If you really want to, just walk out your door, and there are hundreds of things that you could be a part of, whether it's socially or physically. You can go play golf, you can play bridge, you can go to the sewing room.
Absolutely.
Whatever it is,
Absolutely.
you need to just get out there. Like you said, you're either going to use it or lose it.
Right.
And it's important that we, take care of ourselves, and it's important not only for yourself, but for your family as well. So be sure and be a part of this meeting. It's going to be tomorrow at 10 o'clock. Probably going to run till about lunchtime, and that's sponsored by Alzheimer's Orange County Club, and they are going to be at Clubhouse 3 in dining room number 2, and you'll be able to listen to Dr. Gustavo Alva, and he's going to talk about dementia, memory loss, and aging. And of course, with the silver tsunami approaching us, that's going to affect quite a few people.
Absolutely. Yeah. I might add one other thing. He'll talk about that there are 79 medicines in development right now. 2 of them have shown very positive results in the last year. And both of them are demonstrating a slowdown in the development of amyloid. And amyloid is the vehicle that carries the tau, in tangles which destroy neurons.
Okay.
So it's that's a more positive news we've had in the last several years.
That is good news. Before I let you go, what is the average age of someone, or do they even have one yet, that it's usually affected? Is it in the 60s, mid-60s?
1 out of 9 at the age of 65 will
65.
have some type of dementia. 50%, 85 and above, will have some type of dementia.
Wow. Well, we're hoping that there's a cure for this disease here in the in the near future, and with professionals like Dr. Gustavo Alva, we'll kind of get to that pretty soon. I hope sooner than later.
Sooner than
and
later.
Especially with the Alzheimer's Club here in Orange County, we do encourage you to help them out. So come on over to this meeting 10 o'clock tomorrow and get this information and get some really good information regarding dementia or Alzheimer's. As we age, you're going to know someone that is affected or has this disease.
Exactly, exactly.
Thanks so much for joining us on the program today.
Thanks for inviting me. Nice to see you.
You bet. We'll be right back with more of our program right after this.